Florence Okun has been living with HIV since 2001. She, however, started receiving treatment 3 years later after coming to Kampala. At Alive Medical Services in the outskirts of Kampala is where Okun has found it reliable for her regimen. Okun told us that living with HIV, an incurable illness, is traumatizing. However, acceptance is the first step to heal.
The best thing people should know is to be open to your doctors, and you follow strictly what they tell you to do, you will live.
In Uganda, the first cases of HIV and AIDS were recorded in Rakai district in the early 1980s. In the early 1990s, Uganda had one of the highest HIV prevalence rates. But a robust government campaign promoting a three-pronged AIDS prevention message, abstinence from sexual activity until marriage, monogamy or faithfulness within marriage, and use of condoms as a last resort made gains against the scourge. Antiretroviral drugs for treatment came at a later stage in the 1990s. Florence Okun has been on ARV treatment for 14 years now. She told us her experience while using the drugs.
At the beginning, the drugs were really so strong in the body. I in fact don't know why.
This was due to some ingredients used to manufacture the drugs at the time. The revised guidelines from the National Antiretroviral Treatment and Care Report of 2008 shows that those particular drugs were preferred due to cost and availability.
The drugs nowadays are not so badly as in the beginning.
With the advancement that has happened, we are seeing people with better adherence because of reduction in the pill burden, but also in reduction in the side effects. Okay?
And this is because tenofovir-containing regimens have been included as alternative first-line therapy because of the low toxicity profile. Each year that goes by, new guidelines for treatment and management of HIV and AIDS are developed due to improvements in the drugs.
From the days where I would have a burden of pills, now we have reduced it. We are now having like 1 pill a day. From a time when we had to wait for the person's immunity to go down to below 200 for someone to start on antiretroviral medication. A lot of advances have happened such that now we are having what we call test and treat. In other words, all those who are testing positive right now, they are started on treatment immediately. What that means is that there is a reduction in the number of people presenting with what we call stage 4 events, okay, before they start on treatment. In other words, those who are bedridden, those whose prognosis is poor.
However, one of the emerging challenges globally is the drug-resistant HIV strain.
There are instances whereby the virus develops what we call mutations that gives it an ability to not respond to the treatment. So as per our guidelines, what happens is when we find that the viral load is high, the first instance, the person undergoes what we call intensive adherence counseling. If at all the viral load is high and through the sessions we've discovered this person has actually been adherent to their medication, that's when we get to switch them from one line of treatment to the other. In treatment and care, so far we have 3 lines of treatment. What you had like first line, second line, and third line. First line is the medication the person starts off with when they are starting treatment, okay? Then second line is when the person has failed on the first line and has to go to another set of medication which would refer to as second line. And then if they fail on second line, that's when we have what we call third line. Third line is not yet widely distributed because it is still expensive and the drugs are still a bit scarce.
According to the Uganda Demographic Health Survey report of 2016, the country's prevalence rate is 7.3% with up to 1.6 million people living with infection. As the world fights to see a reduction in new infections, medical experts in the developed world are trying out a single-dose injection that will be administered monthly to the sick and a vaccine which will be used to protect those who are not infected. However, all this is research and trials. Walter Mwesije, NTV.